I want to raise again the case of the elderly, vulnerable people on hunger strike. They're 22 days on hunger strike now outside Leinster House. They're survivors of industrial and reformatory schools. They're putting their health on the line to try to access justice both for themselves and their fellow survivors. They were failed once by the state when they were committed to these heinous institutions, that are being failed again now. Their ask is very simple and very modest: to access a full HAA medical card and a full state contributory pension based on what has been awarded to survivors from similar institutions but from which they've been excluded. It's not enough that the state acknowledges that it's failed survivors historically if it excludes survivors from redress for these past wrongdoings. It's showing that it hasn't learned lessons. It's obviously getting to a very grave situation when we're 22 days for elderly people, and asking if there can be an intervention here.
I have met with the group last Friday week. I asked the group into government buildings, and we met in the Taoiseach's offices and had a lengthy discussion. You know the history. I would have established inquiry into the industrialist schools. That was followed by a comprehensive redress scheme and other measures that were taken. And we're willing to engage, and I've asked my officials to look at all the various requests from the group, but there are repercussions elsewhere, and it's not as simple or straightforward as has been presented. But we are willing to engage. There was quite a list of issues that were discussed. I've asked my officials to look at those issues, and I'm also meeting with the Minister for Education, who's also offered to meet with the group, or officials, on our behalf, have offered to meet with the group. So I would like this resolved, but I think there has to be a bit of sort of flexibility, and maybe get into a sort of a process whereby we can.
Thank you.
I'd like them to come off the hunger strike, because I think it can be damaging health-wise, and I'd like them to come off it in good faith, that we would engage on issues and try and improve what's there already.